Hello and welcome to today's Here's to Your Health podcast. I'm your host, Don Lensman. My guest on the podcast today is Dr. Elizabeth Ranniger. Dr. Ranniger is a pediatrician here at CCMH. And Doc, thanks for joining me today.
Thanks for having me.
You know, you've been here about as long as I have, but maybe to give people kind of a good idea of your background in education, why don't you just share that with us real quick?
Sounds great. Yeah, I grew up in Atlanta, Georgia, attended University of Virginia for my for my medical school, and then I went to Northwestern in Chicago for a residency in pediatrics.
That's why I don't have any of that southern accent.
That's correct, and my parents are from out here, so
they're actually pretty local. Your folks are from this neighborhood, yeah.
Yep, they are. So met my husband out here, and I've been here for the last almost 10 years. Hard to believe.
Wow, that's amazing.
Yeah.
So let's talk a little bit today about physicals for the kids, because that's, people will say, but they're not going back to school yet. And I know they're not going back to school quite yet, but as a parent, we're getting to the end of that summer sports season, and it really is time to start thinking about getting some of these things in order. And every year, and it's state law, that most every year, kids have to have a physical to be able to go back to school. So let's talk about that a little bit. What's the difference between an annual back-to-school physical and a sports physical?
Yep. So there is definitely a difference between those two things. The thing that I want to reiterate is that your child's doctor can provide both of those exams, a sports physical exam and a back-to-school physical or an annual physical at the same time if you request it. So you just have to make sure to tell the desk when you're scheduling. But a well-child check or a back-to-school physical or an annual checkup, those are all kind of the same thing. That is a comprehensive checkup where your doctor evaluates your child's overall health. That can include anything from growth and development to their social and emotional health. We a lot of times address underlying health conditions that they may have, and that's typically performed every year after about the age of 3, and includes administration of any immunizations that they may need at that visit. Then a sports physical, though, is a little different. It's necessary for any kid that is older than 7th grade who wants to participate in sports. And your doctor will ask you some specific questions, or your child some specific questions that evaluate for any underlying illness or predisposition to injury while they're playing sports. So this year and in the past years, we've done these in conjunction with annual checkups so that we can kind of provide a more comprehensive assessment at that time, and then that we can also evaluate for any immunization needs.
And to give people just a window into why this is important, I'll just use myself as an example.
Yeah.
When I was getting ready to go into the 9th grade, I went and had my back-to-school physical. And they found a heart murmur, and they sent me around to a bunch of specialists. I was in a semi-trailer in a parking lot in Iowa City.
Oh boy!
Which at that time, this would be 1970. I don't want to give it all away, but the early 1970s.
There you go.
Circa 1971, 72. Somewhere in there.
Excuse me. Sorry.
That was when they first had the very, very rudimentary CT scans. And so I got one of those, and I was put on medication for a couple of years. I grew out of it, which is a good thing.
Yeah.
But that's the value of having those physicals, because you do find underlying health conditions that you might not know about otherwise.
Absolutely.
But when we talk about those physicals, Doctor, what should parents expect when they bring their child for their examination?
Yeah, so typically, basically an annual checkup or a back-to-school physical is a good time for your kid and you to feel safe and comfortable in the place where you receive care. It's good to go to a doctor who knows your child and who has taken care of your child for a while, so that you can kind of establish that rapport and that knowing and care of your child. That improves your kid's health, just having somebody who knows your kid from the start, right? The doctors typically check on how the previous school year went, how their physical growth, their emotional, social development, academic development, all that kind of stuff. We could talk about that. We follow a growth chart to make sure that they're nutritionally doing well. We check on their sleep. We check on all sorts of different things. And do a full head-to-toe physical exam. I think that's an important part to note. We check everything out, even if you don't have complaints about it. So that, just like you said, you can evaluate for a heart murmur, or you can look for scoliosis or those kinds of things. I mean, all those things should typically be checked out during an exam.
So one more question, and then we're going to kind of regroup here for just a second.
Yeah.
What should you tell your child when they get ready to go to a physical, right?
Yes.
So Tommy or Susie maybe has a little trepidation about this. But as a parent, what do you say to your kid before you bring them in?
So when kids are prepared, it typically helps them feel better about things that could be potentially stressful. We know as adults it's not typically that stressful to come to the doctor, but some adults it is. But for kids it can be very anxiety provoking. So just talking to them prior to the visit. For little kids, that could mean, getting out the doctor kit and just pretending, mommy's the doctor and you're the patient and here's what's going to happen, going through listening to their heart and putting them on the scale. The scale is always dreaded by every child.
Believe me, it's dreaded by most adults too.
Yes, it is. So that's a good way for the littler kids to kind of just do some role play, right? For older kids, just talking to them about why doctor's visits are necessary every year to kind of talk about their preventive health. And the big thing is shots. Kids are always scared about getting shots. Well, don't ever promise your kid that they are not going to get shots because you can't promise that as a parent. It's good to talk to them about potentially you might get shots at this visit, and here's why. We want to keep you healthy. This prevents us against specific diseases, and that's why we give you shots, and that's why you get that temporary discomfort, but it goes away very quickly.
Yeah, there's no good way to say it, actually.
No, there's not.
You might need them, kid, but that's kind of the way it goes. But setting the right expectation, I think, is what you're talking about,
Yes.
and all of us. Whether you're a child or an adult, it doesn't matter. Everybody wants to know what the expectation is. So I think that's excellent advice.
And have your kid ask questions. Like if they have questions of you about the visit, feel free,
Absolutely. My guest on the podcast today is Dr. Elizabeth Ranniger. We're talking about back to school and sports physicals. Dr. Ranniger, a pediatrician here at CCMH for the last 10 years or so. When we talk about shots, it really is the question of immunizations and vaccines. And I know that this is kind of off the beaten path a little bit, maybe isn't quite on our radar screen in terms of what we had decided to talk about today, but just as a brief, quick aside.
Yep.
There's been a lot of talk about this for parents who are listening today. Mm-hmm. What would you tell them about immunizations and vaccines?
So typically there are scheduled visits where your kid will get immunizations or vaccines. All schools require vaccinations, and these are very important ways that you can prevent severe illness for your children. There's been a lot in the media and controversy recently, and I would just encourage you to talk to your doctor. I mean, your doctor has gone to school for this and has, looked into all of these things and can talk to you about any concerns you might have. So I just encourage you to ask questions, but typically kids will get shots around their 4-year visit, their 11-year visit, and their 16-year visit, and then potentially some boosters in between. And those are usually the required shots that they would need.
The only thing that I will tell you about that is don't believe everything that you read, don't believe everything that you hear, and certainly don't believe anything that you see on the internet.
Absolutely.
Because there's a lot of misinformation out there about that. And I agree with you. Talk to your doctor, get this straight, skinny from them.
Yes.
So for parents who are bringing kids for their back to school or sports physicals, if they have concerns, should they bring those along with them?
That's a great idea. Yeah. It's good to write down those concerns. Sometimes when you're in the moment of the visit, you'll forget and then you think about it later. But write down your concerns and ask your primary care provider. Do remember that annual visits take time, and we have a lot of questions for you too to kind of follow up on the child. So prepare 1 or 2 of your most pressing questions, and then if you have a lot of other questions, you may need to schedule another appointment just to discuss the extra questions. It's also good to involve your kid in the appointment, and so a lot of providers will try to do that too by asking the child the questions, but prepare your child, that we may be talking directly to them, especially the older kids, and they should be able to answer the questions too. So.
Yeah, absolutely. My guest on the podcast today is Dr. Elizabeth Ranniger. Libby is a pediatrician here at CCMH. She's been here for about 10 years, and her practice is all about kids, and that's why we have her talking about back to school and sports physicals today. Excuse me. So one of the questions, and of course I alluded to it earlier, is that people are saying, "Man, we're not going back to school yet for
Yes.
almost 2 months. Why are we even talking about this?" What would you say?
That is a great question. So I think the biggest point to throw out there is that provider schedules can fill up really quickly in that back to school season, which honestly has started to be earlier and earlier every summer. So I think it's just really important that if you delay your appointment until the end, or even till July, the end of July sometimes, that's really pushing it, and you may not be able to get the appointment as conveniently as you would like. So probably not going to be the same day or that kind of thing. If you do it now, it's going to give you better options for who you see and when you see them. So I would just try to do it as quickly as you remember. And it's important to remember that a sports physical and an annual physical are good for a full entire year. So whenever you get that visit done, the sports physical form is good for 365 days. So don't be concerned that you're going to play basketball in the winter and it's not going to be good then, because it will be fine.
Yeah.
So
this is one of those things about people wait until the last minute to do their Christmas shopping.
Oh, gosh, that's me.
Absolutely the same thing, right? Because everybody's going to want this done, and they're going to want it done before the kid, and they have to have it done before the kids go back to school.
Right.
Now's a really good time to plan that out. I realize people are going to be going on vacations and things with all the summer sports starting to finish up.
Yeah.
But let's make some time for this, because it's an important thing for kids and for their development.
And for some of the sports physicals, they need them even before school starts, because I think like football practice and stuff starts before school starts. So just keep that in mind, and you want to kind of have it done a little bit beforehand in case there's anything that comes up during the visit that would prevent your child from being able to play sports, right?
Absolutely.
Like Don, you might have to go get a cardiology visit or something.
Yeah, and here's the crazy thing, that I could not play football, because that's what this is about. I couldn't play football until about halfway through the schedule. If you've ever played ninth grade football, you'll know that I missed about 3 games. There's only 3 left. So then what happened? I came back, I wasn't in good shape, and then I got hurt.
Right.
So, just make sure that you're planning this out a little bit, because there are a lot of things that could necessarily take place.
Yeah.
We just have to plan ahead a little bit.
Yeah.
So in speaking of that, Doc, if anybody wants to schedule a visit, how do they go about doing that?
So probably the best way is to call the medical clinic, CCMH Medical Clinic, at 712-265-2700, and our patient access professionals can help you find a time that works with your schedule. You can also request an online appointment by going to ccmhia.com, and then on the homepage you click on the link for online appointments. And I would encourage you, we've talked a lot about sports physicals, to do those in conjunction with your child's back to school physical, since that's what we kind of are trying to do this year.
Anything else you'd like to share before we finish up today?
I think that's it.
Hey, I really appreciate your time today. Thank you so much.
Thank you, Don.
My guest on the podcast today, Dr. Elizabeth Ranniger, pediatrician here at CCMH. We're talking about physicals, both back to school and sports physicals. And again, just to reiterate, if you'd like to go ahead and make that appointment for your child, call the CCMH Medical Clinic at 712-265-2700, or go online at ccmhia.com and you can request your appointment there. I'm your host for the Here's to Your Health podcast, Don Lintzman. Thank you for joining us today. Thanks for listening. Have a great day.